there is so much we can learn from the world to really adapt those global learnings to really advance health in our communities. And we're doing that at our agency about Global and One Health. And I'm just curious about how do you see that adaptability? Not everything in the world is going to work in our communities across the U.S., but there are a lot of things that can and could. So talk about that a little bit.
Yeah, no, I think we need more exchange, right? I think the U.S., all of us here in the U.S. should be open to learning from other countries. There's a lot of innovation taking place in other countries. Some of it's on the groundwork, innovations in just how you reach communities, as I mentioned, all the way to high tech and science. So we've got to embrace that. And I think setting the table for that, having the exchanges, being able to learn is super important. CDC does some of that. I mean, I've had, when delegations come over from other countries, they say exactly what you said. They're always like, we want to learn from the U.S., but we have a lot to teach.
Interesting.
So we need to remain humble and continue to
There's
listen
a lot
and learn.
more to,
That's right.
We spend a tremendous amount of time collecting the dots. We need to spend just as much time in connecting those dots. And that's what Public Health Connects is all about. My name is Dr. Umair Shah. I'm the Secretary of Health for the great state of Washington. This is Public Health Connects.
I am so pleased to have this conversation with my friend, colleague, Dr. Judy Monroe. Dr. Monroe is the President and CEO of the CDC Foundation currently. And what that means is that you have had so many career paths and journeys to get to where you are today. Judy, thank you so much for joining today.
Thanks for having me.
Such an honor. Well, let's start off with I just mentioned the journey. Tell us about your journey.
Sure. So my journey actually started in medicine. I'm a family doc, and I practiced in Appalachia. Thought I would just practice in a rural community and help folks that needed help. I was wrong. That wasn't the end of my career. I ended up getting into academics. My husband took an academic career, so I followed him.
Okay.
And from there, I got a call one day from the governor of Indiana asking me to be the health commissioner. So I
know about those calls.
Yeah, you get those calls. You don't expect them, and the next thing you know, you're going one day from being a practicing doc to leading the health department and leading in my case, the state of Indiana for their public health. It was a great leap, big steep learning curve, but I loved it and found a real passion for public health. From there, I went to CDC, was a deputy director of the CDC, and I helped support all the health departments. My job was over state, tribal, local, and territorial support. And from there, I found myself being recruited to be the CEO of the CDC Foundation.
And what is the CDC Foundation? First of all, I was going to ask that question, but I should say, originally from Ohio, you have an Ohio connection.
Yep.
Otherwise, Ohio and Indiana have some rivalry, so I just want to kind of put out, but it should be about cooperation across state lines and all that stuff. But you from Ohio, right? Wasn't there also a connection with
I grew up in Dayton, Ohio.
Okay,
right.
Yeah, Cincinnati. So
Yeah.
woo.
Well, see,
Okay,
I
go.
knew I liked you.
There you go. At least one person does. All right, we're good. CDC Foundation. What exactly is it? What do you all do?
Yeah. So CDC, of course, Centers for Disease Control, actually authorized by Congress to be an independent nonprofit to help forge public-private partnerships on behalf of CDC and public health. So our mandate's actually very broad to support public health, and actually some of our key work right now is supporting health departments. We've hired tons of staff, particularly during the opioid crisis and then during COVID.
During the pandemic,
We ended up hiring over 5,000 people.
5,000?
5,000 people that were embedded. We literally had CDC Foundation field staff in every single state health department, large cities, tribes, territories. It was work that just needed to be done because folks were having trouble hiring, and we got called and tapped to do the job.
Yeah. So let me ask you a little bit more about CDC Foundation, because there's also an interesting agency or organization, because not only do you do domestic work, you also do global health work. And I find that intersection fascinating, because I've had trouble finding agencies that are really doing good jobs in both, or trying to find some inflection points, if you will. So can you talk a little bit about the global health piece?
Well, I love our global work, let me tell you. Part of the reason we do global work is because of CDC. And folks may not realize the reach CDC has around the globe. So they have country offices, regional offices now all across the globe. And if you travel to other countries, you go to Thailand, you go to Vietnam, you go to Africa, many of these countries, you'll find that their top leaders were trained by folks at CDC. They either came to CDC for some training or they learned about CDC. So that's part of the connection. For us, again, public-private partnerships, we've done work across the globe for decades now in tobacco control, data. We've got a great program funded through the Bloomberg Philanthropies.
Okay.
And it's data for health using iPhones, or using everybody's got the mobile phones, and using those to be able to collect critical data to be able to make good public health decisions. Where do you put your resources? How do you message? All of those questions that we have in public health.
And are you seeing themes, just to kind of, sorry to follow this thread a bit, but are you seeing themes across different countries about how they're using technology or mobile phones or what have you? Or do you see it as like, this is this country, you can't really learn with this country, it's completely different?
Yeah, no, most countries are using mobile phones in one way or another, and many countries are really advancing even AI now as well. And a lot of countries like to build their own. So as an example, Vietnam, I was just there in the spring, and they're doing some incredible work with tuberculosis because they have multi-drug resistant TB. But to hear how they've embraced technology to do that, they're using AI to read chest x-rays.
Oh, wow.
40% increase in the diagnosis of TB over the radiologist.
You're kidding.
No, it's
wow.
it's very impressive.
It's impressive, yeah.
And then the other thing they do, there's these great photographs they showed us to get the x-ray machine out to the most remote areas. The poor x-ray machine is like out in the middle of the ocean on a boat. I mean, they transport the x-ray by boat. So they talk about equity. I mean, going to Vietnam, seeing this marriage of technology with a real drive to reach everybody, regardless of where they live. Really incredible.
Oh my gosh. So I recently was in Taiwan and had that same experience. I know you've had that same connection as well. And so you've seen how they are leveraging AI and technology as well and trying to look at that. So there's a lot to learn from the rest of the world. And I'm always fascinated by this question. I'm just going to pose it to you. Sometimes we're thinking we're in the US and we're going to teach the world. Remember that old song that was like, I want to, I'm not going to sing it, but I want to teach the world to sing, right? But there's so much we can learn from the world to really adapt those global learnings to really advance health in our communities. And we're doing that at our agency about Global and One Health. And I'm just curious about how do you see that adaptability? Not everything in the world is going to work in our communities across the US, but there are a lot of things that can and could. So talk about that a little bit.
Yeah, no, I think we need more exchange, right? I think the US, all of us here in the US should be open to learning from other countries. There's a lot of innovation taking place in other countries. Some of it's on the groundwork, innovations in just how you reach communities, as I mentioned, all the way to high tech and science. So we've got to embrace that. And I think setting the table for that, having the exchanges, being able to learn is super important. CDC does some of that. I mean, I've had when delegations come over from other countries, they say exactly what you said. They're always like, we want to learn from the U.S., but we have a lot to teach.
Interesting.
So we need to remain humble and continue to
There's
listen
a lot
and learn.
more to,
That's right.
exactly. It's bi-directional.
Absolutely.
Absolutely. Well, let's talk a little bit more about, I know you mentioned that you were the previous commissioner in Indiana,
Right.
and you also were re-asked to come back to Indiana and help with an initiative their governor was putting together. Can you talk a little bit about that?
Yeah, I was actually in the middle of the pandemic, so it's July of 2021. We're still,
gosh.
I think, I don't forget
Vaccines
which
were-
variant. We
variant Delta,
were really busy, and I get a call saying that Governor Holcomb would like to invite me to co-chair the Governor's Public Health Commission, and so Indiana took on the issues of public health starting in the middle of the pandemic. And it was such a privilege to go back to Indiana. I know the state well.
Yeah,
and,
of course, yeah.
It was great to go back, and I co-chaired along with Luke Kinley, who was a 25-year veteran of the state Senate. So
Okay.
Senator Kinley was my
Senator Kinley,
co-chair,
yeah.
and it was a great marriage between someone that like myself that had a career in public health and someone that really knew the legislature
The politics,
and the
yeah.
politics and knew how to manage. And then we had a tremendous commission. And we spent a year studying. There was an executive order by the governor, so we had to address certain things like data, equity. There were a number of things outlined, which we did. But one of the key things was the listening sessions. So we went around the state and listened to communities and got their input on what the commission and what kind of recommendations we should make. And that was a fascinating experience.
And I'm so glad you said that, because we oftentimes in our field talk about community, but we really don't always reach out, embrace, or are humble enough to listen to community. Talk a bit about either what you're seeing in the field with that conundrum, and also what learnings you had as you were going through the AHA experience of hearing community. Were people in Indiana, for example, there were some things that they said that you would have never brought to the table.
Right.
It was surprising to you. How does that play out?
Yeah. Well, first of all, it was during the pandemic.
Sure.
And so there were some that would come to the listening sessions and were quite angry, right? They were upset over masks
Policies,
or
yeah.
policies and so forth. And we listened very respectfully, and we listened hard for those ideas that they had that could translate into the recommendations. One of the things really important to Indiana is home rule.
Yeah.
They want to
Same
be
in
able
Washington,
to have
same in Texas, yeah.
Exactly.
Yeah,
So they want the decision making to be at that local level. And the cool part about this is that got translated into the recommendations and then ultimately into the law, which is, it's now called Health First Indiana is the
Okay.
name of the implementation.
Okay.
But every single county got an increase in state funding at the tune of 1,500%. State funding.
1,500%.
1,500% increase in state funding to local health departments, and the local health departments have, and their communities, a lot of community engagement, are responsible for the priorities they want to select. I mean, there were some parameters, there
Yeah,
were
sure.
some things that were standardized, and then
Right.
others, you're free to decide what's most important for your community.
So when you saw that kind of 1,500% increase, was that because it was community saying to the ones who are listening to say, this is important to us. So as a legislator, policymaker, listen to us because we are your community. So
That's right.
listen to us. We're saying you need to invest more in a system or public health or what have you. Or was it
That's
something
right.
else?
Yeah, no, that was much of it. In fact, it was an opt-in. So the counties they just weren't given, they had to actually opt in to take the funding. So the first year of funding, there were some outliers. There were a handful of counties that said, we're not taking the money.
Oh, really? Okay.
And so it was like 92 or 93 counties in the state, and 88 or 89 took
most
the
didn't, but
money.
not all. Okay.
The second year, 100% took the money, because their communities, the ones that hadn't taken the
why
money,
didn't you?
they all were like, but we have needs. We have public health needs, and we need the resources to be able to take care of it.
Oh my God.
That was really cool. So now they've got Health First Indiana across the entire state. It's all been opted in. You've got the Hospital Association that pledged to support Health First Indiana. So now at the local level, that translates to the local health departments working with the hospitals. The business community, Chamber of Commerce, got up, and this was all at a big second rally at the State House a year after the legislation had passed. We had this fantastic rally the first year to try to get the momentum to pass it.
Yeah.
But in the second year, you've got your business community and your hospital standing up saying, we pledge to do all we can to help support Health First Indiana. That's all being translated now at that local level.
That's incredible.
Isn't that fun?
Yeah, it's amazing. I know you and I had some conversations about the things that we're doing in Washington around foundational public health services
Yes.
and the funding,
Yes.
and our transformational plan and activities related to that. So there's a lot that seem similarities in terms
Absolutely.
of how some of that plays out. I'm curious then. what are lessons that you would say are for all of us across all systems, across all states or all parts of our country when we look at this, right? So not just in Indiana, not just a particular state, but what's a lesson? And I know you mentioned business community, and I know this speaks to you because you and I have had a conversation about how do we get to the people who really have a lot of the purse strings in our country, but don't always think about public health or health and well-being in the same way. We think about healthcare delivery, but we don't think about prevention. So how does that all play out for you?
Right. Yeah. Well, on several levels, and I'll actually start with trust. I'd love to outline. There's a great book called The 4 Factors of Trust that came out in the last year or so. I've really been applying this to public health and the work that we do. So what the book says, the 4 factors are humanity, transparency, reliability, and capability. Okay? So your humanity and transparency tells me what your intent is. If I can trust, I know you really care, and you're transparent, I trust your intent. And if you're reliable and capable, I know you're competent. Right? So that's a starting point, and that's a starting point for all of us in public health. That applies to businesses, it applies to any organization, right? So I think applying those or looking through that lens is really helpful. We all need, and then if you take that and think about it, we all need to be listening more intently. That's a common theme. We need to listen with humanity and with the intent to really understand what the other's saying, because that's you can translate that into some really great things that you may not have thought about. So that's a lesson in humility, but also the listening. I think that's super important. I think we also have to break bread more often. I think we need to.
Unpack that for
I
me.
think that's. I'll give you an example, a hard example. When I was at CDC, we were in some meetings with our tribal advisory committee at the national level, right? And we were having some difficult conversations, and folks were upset. And I remember thinking, what can I do? Because I was leading the office at that time. And at a break, I went out and I asked some of the tribal leaders, I said, what are you doing for dinner tonight? Would you mind if I joined you? Just me. I just would love to join you. And they said, sure, that'd be fine. And so we met at a restaurant. And guess what? You know what the first part of breaking bread is? You're talking about your children. You're talking about your families. You're talking about illness. You're talking about things that bond us as humans, right? Once you have that breaking bread moment, whatever that looks like, now you can talk about the hard things and you understand one another. You're going to find the common ground. You're going to find the middle ground. You're going to find solutions much faster.
It doesn't solve it all, but it certainly makes it easier.
It sets the stage.
It sets the stage. Right. Oh my gosh. So I've so much to unpack here. Our transformational plan, EIE values equity, innovation, engagement. You've talked about engagement. You've talked about innovation. You've talked about equity. I can't, you've operationalized these. So let me not ask you about that specifically. I'm going to ask you a different question.
Okay.
I'm going to throw you a curveball here. I know you love sports and baseball, so here's a curveball. You've had a career where you've seen so much and you've been a part of so much. Do you feel at times that we are having similar conversations that we had 5 years ago, 10 years ago, 15 years ago, and that we are making progress in resolving or solving issues? Or do you feel, or maybe it's not an either or, it's an and, or do you feel like we're still having the same conversations just in a different way? What's your take on that?
So first of all, I have to tell you, throughout the entire pandemic, if someone had given me a multiple choice test, my answer was going to be all of the above.
Always D.
Or my answer was going to be both and, right? So my answer, I'm going to default to my answers, and my answer is both and.
Yeah.
I have to tell you, there are many times I'm in meetings and I'm like, that was 20 years ago I was in this meeting.
That's right.
And it hasn't changed.
Yeah.
And that's a problem, right? We've got to move on, particularly in public health, right? I mean, that's we need to move on. The flip of that, though, is that we started talking about AI and just the technology alone. We've got wastewater surveillance now. We never dreamed of that 20 years ago, right?
These were like dreams of,
We've got incredible dreams. We've got communication channels we never had, right? And that's both the good and the bad, right? Social media is amazing.
Yeah.
And then it's got
challenges.
It's got challenges. And so I think I'm hopeful because of the innovations. I'm hopeful because of young people. You know, I mean, we've got some great. It's amazing the energy here at APHA.
You have so many.
Unbelievable, right? But I think we've really got to be serious when we find ourselves in rooms that we're saying the same thing.
Yeah. We have to really get to not just talking about it.
Let's do it.
But how do we get to the solutions
Right.
and get to? So the other piece for me is the urgency.
Yeah.
Right. So sometimes in our field we feel like we've got time. And that time, then the next thing you know, you look at your watch or your clock, and it's been 5 years, 10 years.
That's right.
The time
That's
goes,
right.
so you have to have an urgency in the
right.
issue as well.
That's
So,
right. I heard the
yeah.
other day someone say that, especially if you have young children, the days are long, the years are short. So some days you might feel like you've had a long day and you're tired. You turn around and it's at 5 years, 10 years. So there is urgency.
Yeah. Well, I know you have an incredible amount of hope because you're one of the most optimistic people that I have ever met, not just in the field of public, throughout. There is this opportunity of being hopeful, right? We talk about the challenges, what are the real concerns, the lack of investment or understanding and all those things. So let's put all that aside and let's talk about hope. Not 10 years from now, but let's talk about next year. What gives you hope for the year that's coming?
Yeah.
In the field of public health or beyond?
Well, I find hope, first of all, in coalitions. I mean, it's just amazing the power of coalitions if they're well led and folks come together. So I'm seeing some coalitions that are forming and are taking on some big challenges. So I'm hopeful about that.
Yeah. Name a coalition like that you that really gives you that kind of.
The Health Action Alliance actually is one. And I don't know if you're familiar with it.
I've heard
we actually helped start it. The CDC Foundation helped start it during the pandemic. They took on helping CEOs, so this bridges the private sector. They helped CEOs understand what was happening during the pandemic and translate that into what the CEO should be messaging, what policies they should have. Yes, you should let your employees off to get vaccinated, those types of things. That then was so well received by Fortune 500 companies that they continued now looking at mental health. And they've taken on there's a commission now, a national commission on climate and workforce. So what should employers be thinking about to protect their employees in extreme heat, right? And what kind of policies does that look like? That's a huge coalition of businesses. But it's got great leadership through Mediarite is the name of the company, or the kind of a social action group.
That's great.
And they've got great leaders. So that would be one.
Coalitions,
That'd be one example.
Okay,
APHA has some coalitions that are forming that are getting a lot of power behind them.
Yeah. No, so the hope is in the coalition, the power of the collective to be able to do big things and also hopefully do them faster with an equity lens. Is that kind of a...
Yeah, that's perfect. That's beautiful.
I love it. Okay. Judy, we could go on for a long time, as you know, but let me close with this last piece. I'm going to reach over here for the apple.
Okay.
So as you know, we launched recently our Be Well WA initiative, Be Well Washington, and this is our health and wellness initiative, 4 pillars, if you will. We're focusing on movement, nourishment, emotional well-being, and social connection. So those are our 4.
Beautiful.
And what we're saying to people, and because we're known for apples, we're asking 8 million people, what is your apple? Find your apple. And then people are saying things like, oh, it's dancing, or it's playing Scrabble with my my friends, or whatever that is. So as I give this apple to you, I will ask you, Judy, what is Find Your Apple? What does that mean to Judy Monroe?
Yeah. So I have to tell you, when I think about finding my apple, it's reawakening my 10-year-old self. And my 10-year-old self, and I've done this this summer was a great summer where I recaptured that age, and what that day will look like is a Saturday getting up and biking to the pickleball courts and playing a little pickleball, going kayaking, maybe taking in a swim, relaxing with friends in the evening, and being out in nature, just being out in nature to reconnect. I love a really physically active day with a lot of variety, and that's what I did as a kid. And I ate a lot of apples, and Washington has the best apples yet.
It does, and not only that, pickleball started in Washington. I don't know if you knew that.
There
Bainbridge
you go.
Island near
That's
Seattle.
right.
That's right. So just
That's
putting
right.
it out there. So that is probably one of the most insightful answers that I have gotten for that question. So thank you for saying that. Thank you, Judy, for joining today. This has been a lot of fun. Thank you
Great to
so
join
much.
you.
Good to see you again.
Good to see you.
Public Health Connects.